So the first question, Carol, I think really help all of us to understand what is gerontechnology. Right.
So actually, gerontechnology, if you look at the term, right, is actually combination of gerontology and technology. So you may ask, what is gerontology, right? So a lot of people also don't know about this term. So gerontology is about studying about the aging. So for me, I like to use the term age care technology. Yeah, and because I find it is more down to earth. Yeah, and then in United Nations, they actually also use another term. It's called assisted living technology. And why they use this term is actually echo to the intrinsic capacity of a normal person. So if we know that when we get older, and our intrinsic capacity will get declined. Yeah, and how can we actually use the technology product to help our elderly to maintain or improve their functional care? So this is actually very important. So that's why, just give you a brief understanding what is gerontechnology. Of course, there are different products. So when we actually look into the gerontechnology, we should actually look into different aspects. Individual aspect in terms of how the elderly use it, and then also how does the caretakers, they use it also. Institutions perspective, because there may be some gerontechnology can help to reduce some of the manpower within the institutions. Like in nursing home, they will use some of the robot to help to deliver meals or deliver some of the product within the institutions. So and then another thing is about the ecosystem, because we are talking about ecosystem today. So whether we have common understanding what we are actually talking about gerontechnology, because nowadays you will see quite a number of organizations, they will say that we want to bring in the technology to the sector, but we actually also need to ask ourselves whether we are ready or not. Yeah, and so that's why Adrian and I, we actually working on a Gerontech ambassador. Yeah, and then so what does it mean? Because we believe if we want to promote Gerontech in Singapore, we need to have buy-in, not only about the elderly, but also the caretaker and even the frontline people.
Yeah, thanks for sharing. So hopefully after today, people know what's gerontechnology much better. Right? By the way, SUSS has a course, right, on gerontechnology as well?
Yeah, we have a course about technology in the aging society. Yeah, and we developed this course, actually work together with one of the professors from Taiwan, Yunzi University, and he himself is actually graduate from the D School from Stanford University. He has a living lab in Taiwan and produce different kind of technology. He used his mom as a test. Yeah, and the reason is he saw his mom get old. Yeah, and then he also need to use, because he actually live in Taipei, his mom actually live in Tainan. So somehow he developed different sensor. Yeah, he actually is engineering trained. Yeah, and so you can see, for those who are in the field, they are very passionate how we can actually improve the, functional capacity of the older adults.
Thank you. Thanks for sharing. Actually, living lab is one key term that I always hear when it comes to elder care, right? A lot of living lab or assisted living. Yeah. So maybe we can ask Sui, right? As an elder care provider today, do you use technology? Right? What kind of technology do you use? Is it more for the operation side of the elder care or nursing home? Or is it really a gerontechnology that helps the elders? Right? And how's the adoption or retention rate? Because we always hear many players test lots of technology, but not long lasting, right? So you have many players outside trying to do technology or introduce technology to elder care as well, right? Can they really use it? Is there a digital divide, right? Like what we say, right? Innovation is good, but can the elders really use it, know how to use it? Yeah.
So do we use technology? I would say absolutely lah, because how can we not, right? And the way we think about technology is it's got to do a few jobs, right? So maybe a bit of context. If you are in the elder care industry, I think there are two words that define what the industry is like. The first is diversity. There's tremendous diversity of services, tremendous diversity of users, right? So it's not true that every elderly, like pre-COVID, elderly couldn't use mobile phones. There was a cohort who could do it. But equally, even today, there is a cohort who still will not use the QR code. Right? So there's tremendous diversity on the part of the users. And then also tremendous diversity on the part of the people working in the sector. You've got old, you've got young, you've got foreign, you've got English speaking, non-English speaking, and all the rest of that. So diversity is one issue we have to deal with, and that throws up a bunch of use cases in terms of, how do you identify which groups are most likely to adopt what kind of technology? Second, how do you deliver a consistent experience or consistent quality of delivery across a diverse workforce? So that's of value as well. Then the second word I think that would describe this sector is that it's resource constrained. And it's not just money resource, which we've talked a lot about, right? So of course, cost is always a consideration. But it is also people and attention, time and attention, essentially. So when we think about technology, right, it's very important to think about what's going to deliver the return on your investment of not just money, but also time and also attention. I think one of the panelists was saying, right, there are so many things to try, but I have to recruit patients for this clinical trial, and then somebody's got to manage this thing. You have to be fairly deliberate about what you try, and therefore for us, when we deliver technology, we think right up front about what's going to be the ROI. Is it going to be scalable? Right? And is it going to be sustainable? That means it will deliver sustained impact and not just sort of something kind of cool to do in the meantime. And I think we have evolved, because in the beginning, actually, there are lots of shiny new toys that you can try out, especially in the Gerontech area. And over time, we've decided to do less of that, or to be very deliberate, right? And have less of the little robots and little things that have mostly a novelty value, and really look at what can deliver a difference. And I would say that it is mostly, I think, first in the area of things that can improve productivity or utilization, essentially manpower productivity or utilization. So all sorts of things on that front. The second is then after that, looking at things that can improve quality of process or consistency of delivery. Right, so this one is more for the staff, but there's all sorts of things that you can do in order to ensure that, let's say, the systems are more consistent, right? The way in which you reduce error rate, right? And so on and so forth. And then the last one is, of course, just client experience, right? Things that are interesting to the client or that expand access. But here is where I think it gets to be a little bit more tricky. So I'll give you an example, right? We have a virtual daycare program that we introduced during COVID, but later we realized that it was actually of value even post-COVID, because there are groups of elderly who are loath to go out to a center. They may actually benefit from the social interaction, or they may have dementia and their caregivers want them to have this interaction, but they don't want to go to the center. So we had exactly one client like that. And when we introduced the virtual program, he actually delved into it every day. And our virtual program is a combination of live sessions. So when you dial in, there is either live exercise or live interaction, but also pre-recorded. So there's pre-recorded content. And what is very interesting is that the persons with dementia interact with the pre-recorded content like it's a live session. So they're doing activities and they're responding to it and so on, and they can do it many times, right? So it's of tremendous value to the people who use it, but the take-up is super poor. It's really, really, really poor, right? Especially after COVID. And so we have a problem, right? What do you do with this? Do you invest in creating more content? Do you, what do you do with this? It hasn't found a market. It's a great product that really hasn't found a market. That hasn't found a market yet, right? So this is an example of how you can have something kind of cool, but very useful for a small group of people. But right now, actually, not clear at all that it would deliver, and so it's not just like a value-added thing, right? So we're trying to, I mean, we've already sunk money into that, but we are trying to avoid those and try and be better at identifying upfront what will really have a sustained impact. So the things that have a great impact for us would be, some are very obvious, like our robots in the nursing home, the AMR robots, right? And I'll just add also, the thing that aids adoption, right, is when we rethink the process along with the technology deployment. So sometimes when we see a piece of technology, it only addresses like one little problem. right? And then you don't consider all the other things that are affected by it. So you're just deploying for that one little problem. And then later you realize that, hey, actually it's not so great, right? Because it doesn't work as, you don't get the full benefit out of it. So it's much, much better when you rethink almost the entire process that this technology is a part of. And then you find that there is sustained adoption, and then you find that your returns are so much better, and yeah. So it's a bit of that. I could go on and on, but I better stop because it's already very, very late, and let Jim move on to the next topic.
No worries. Thanks for sharing. I think very interesting. That's for sure, right? And you point out a very good thing, right? Which we all believe that the adoption is not high, right? And even if you try it, the retention of using technology is a problem. So maybe I can pass the question to Adrian, right? Why do you think it's not high? I mean, why do people like the technology after a while and they don't use it, right? I mean, we can say elderly, there's a digital divide, but the caretaker should be able to be, technology savvy to use it, right? So what is the expectation? What went wrong, and how do you actually get the retention and adoption to be high?
Actually, I'm not sure whether Sui realized this, but I'm indeed the best person to answer to this because we are working with NTUC to promote their Daycare Plus program. Yeah. Yep. So we came to know about the Daycare Plus program under NTUC Health because we know that it's very beneficial for the seniors living at home that cannot participate in the center activities. But I think one of the major concerns why caregivers or caretakers actually didn't immediately think of adopting such program is because there's other priorities in their caregiving duties that they have to look into. The daily necessities of caring for their loved ones in terms of all the medical needs, emotional needs, and so on. And together with juggling their own career, their own children, and whatsoever, activities became less important to them. They were more focused on basic necessity of life like food and the food, the living conditions, the safety at home. There's so many other things that holds higher priority than keeping my loved ones engaged. And when we talk to some of the caregivers on the ground, hey, we got this great program. I myself joined into one of the sessions actually to experience it, and it was great and it was super engaging. I can see that the seniors love it, but the caregivers is just like, okay, it's just another session, without fully understanding how the program was created. So I think answer back to the question is really about the priorities. If we can help them to free out some time to really understand what we have here really helps your family in what way, that will actually raise the priority, and therefore one day they will say that, hey, you know what, this is something I'm willing to pay for, but otherwise at this moment I'll rather pay for better food, maybe better healthcare needs, I don't know, maybe paying for a better domestic helper to help me to take care of my loved ones first. So no, please don't think that your program is not good. Yeah, it's just that caregivers quite a difficult bunch to work with, I must say.
Yeah, thanks, Adrian. So I think you brought up a good point, and Sui also, right? You talk about the value that really needs bring. Same as even just now Eric mentioned, in a hospital, so many startups want to work with them, right? What's the value that you actually bring, right? We can discuss about that. What is the key technology that we can see really bringing value in a while? But let's go to Charlene first, right? I wouldn't say you are the odd one out, right? But I'm very curious to understand from MSD or senior scientist perspective, right? Apart from drug discovery for Alzheimer's, Parkinson's disease, what are other initiatives that is actually letting, let's say, a pharma or life science company to contribute to the elder care, or active aging?
So thank you so much for your question. So indeed, I'm the odd one out here, maybe. Let me clarify that in a moment. Yeah, so I think something that Jim forgot to mention is that I'm actually part of the Singapore Imaging Biomarkers team. So this means that I work a lot with medical imaging. And just to give you a bit of context, right, the pharmaceutical industry is a highly regulated industry. But one area that is currently undergoing revolution right now is basically the AI and ML revolution. And this is particularly prevalent in medical imaging. So I think what you see in medical imaging is that there's quite a number of medical imaging devices being approved by the FDA in the recent years. Yeah, and for myself, one area which I work particularly on is on vision loss. So for example, age-related macular degeneration, and this is specifically a chronic disease which affects many of the seniors and also leads to severe vision loss. So just imagine this. What happens if you can just go to a clinic one day, get an eye scan by a doctor, and then upload the retina scan to a software, and the software can give you an individualized diagnostic score as well as prognostic prediction score. Isn't that powerful, right? So I think this is something that is what we see that AI and ML is actually contributing. And another area in which I think another buzzword that we hear nowadays is generative AI. So generative AI, I think a lot of you heard from ChatGPT, but generative adversarial networks have also been frequently employed, in medical imaging. For example, in age-related macular degeneration, to generate synthetic images, retina images of the patient's post-treatment images. So this means that the patient, together with their clinician, can now see the post-treatment outcomes. Yes, and just now I think Sui brought up a very good point about user adoption. So even if you have such fancy AI and ML algorithms, if it's not adopted by the users, then basically what's the point, right? So something that we are actually working on now in collaboration with NTU is developing a software actually to characterize different retina biomarkers of the eye, and also so that they can be used by clinicians to actually track longitudinal changes as well as compare between different subgroups. So by actually introducing these AI and ML algorithms and fitting them into a very user-friendly interface for our seniors, I believe that medical imaging has the potential to actually contribute to tremendous benefits in terms of patient healthcare. Yeah.
Thanks. Okay, now we know why you are here. Okay, thanks for sharing. I think it's important and good to talk about AI, ML, and biomarkers, which is again in the hospital you have similar needs as well, right? Especially all this software as a medical device and other initiatives. Thanks for that. So okay, maybe we come back to the question, and anyone can feel free to answer, right? Is really how do we increase the adoption? What's let's say the top 3 technology you think is really very useful in this active aging or elder care or gerontechnology areas, right? That people are concerned because there are so many innovations out there, right? But the adoption is low, like what all of you mentioned, retention is low, right? So what are the top 3, whether from elder care perspective, academic, or even from a caretaker perspective, or even Charlie, you can chip in as well. What are the top 3? I mean, there's so many things: generative AI, robotics, IoT, 5G, so many things. What are the top 3 you think, or top 2 do you think is really important to drive the adoption and retention of the use? Yeah. I give you 20 seconds. Any question from the audience?
Anyone? Okay, if not,
Yeah,
I'll take my chance. Within the Gerontech Ambassadors program, we actually teach the seniors that Gerontechnologies can be divided into 4 categories. In Chinese, we call it 衣食住行, which means that it's medical, I would say dining or food related, then safety at home, which is what we call living, and the last one is mobility. So out of these 4 categories, we help people to understand from the very basic of how it enhances daily living at a very community-based and consumer-based consideration, all the way to high technologies like exoskeleton or whatsoever. But if I were to come from a caregiver point of view, I myself has been a caregiver for the past 16, 17 years, caring for my mother. What stops me from adopting a technology is again based on number 1, practical consideration. How how needy and I'm in needing this technology. Secondly, as a caregiver, we spend a lot of money in medical. We pay lots of money already in caring for our loved ones. It must be something that is worth for us to pay for. So, of course, then financial consideration. And then the third consideration is how well I can convince my loved ones to adopt it. If I cannot even find enough reasons to convince my loved ones, I think all of you can give up thinking about it. Because I think as a caregiver, we have the most influence to our loved ones. And if we couldn't convince, then who else can convince that? So with these three considerations, I personally think that as much as it's important to develop deep tech, advanced technology that helps in medical consideration for the elderly, maybe those technologies more catered towards organizations like healthcare organizations, hospital and so on, research facilities. But if you want to go straight to the consumer, you might have to consider that simplicity is actually the most important. Accessibility, cost, and affordability. And these are some of the key essence that you would like to think about. If I want to help a caregivers to really adopt this and convince their loved ones to use it, it must be easily obtainable. It must be cost effective for me to obtain it. It must be easy for me to convince my loved ones to use it. Imagine placing a huge robot in front of my loved ones and says, use this. I think they will run away, get out of the wheelchair and run away from you. Yeah. So, this is what I thought. In answer to the question.
Thanks. Can you share, Carol?
I'm not going to give you top 2 products. The reason is very difficult, to specify what are the products that, popular among the senior and even the caretakers. The reason is, as what Suyin and also Adrian mentioned about, there are different needs of the caregiver and also the elderly too. So one of the things that I find in Singapore, we need to really do need assessment of not only about what are the needs of the elderly, whether they actually like it or not. Just now, we talk about, just Suyin again, you mentioned about actually not a lot of elderly know how to use the scan code. QR code. Yeah, we did a study in Singapore also. Yeah, and then we found out that actually quite a number of the elderly, first some of them they prefer don't try to use technology because they don't want to bother. They have to learn new things. But some of the elderly they want to learn. Yeah, and of course we know that when you learn new things, and it's actually helped you on successful aging. Yeah, but again we have to really understand that elderly is heterogeneous. Yeah, we have to really respect their choices. Yeah, but again, talking about the Gerontech ambassador, because we did this Gerontech tour in the LTES Asia, and then so our participants could join the tour and told us that they want to learn more about the medical device. And those medical devices can help them to maintain their health situations at home, or maybe their health, like if you have stroke, what kind of thing that can allow them to do exercise at home. Yeah, and of course we have daycare, we have nursing home, but if they can do it, day by day at home, then that would be very good. But again, it goes back to the cost. Yeah, how much that they can afford. Yeah, and I give you another example. Even nursing home, right? A lot of nursing home, we also bought Paro. Paro is actually one of the seal developed in Japan. Yeah, and I checked with AIC, 90% of the nursing home, they also have this Paro. Then when I go and talk to the nursing home, I don't know about NTUC. So when I talk to some of the people in nursing home, how many of them, they really use it structurally? Yeah, and because when we talking about research, right? Because research is very structurally done. So within 2 weeks, of course, you will actually really use the Paro. Then how about after 2 weeks, who are going to tell them how to use it? Yeah, and then this is actually, I always ask myself, because I do a lot of applied research. And we do research is not because of that 2 weeks and then that's it. We want the people continue to use it, right? So that means capacity need to come in, capacity building need to come in. We did another study, use one robot in some of the daycare and also AAC. Yeah, and of course, some of the frontline people, they worry the robot will take over their job. So they don't want to learn new things. Yeah, and I was surprised. But after they know about the intentions, yeah, and then so they change their mindset. And then, but if you have the robot also, one thing is we have the product providers, right? Yeah, we have a lot of company here. Yeah, whether we really know about the need of the, participants and even the worker. Because just give you an example, some of the worker they share with me about the robot, yeah, and they try to press the button many times and still cannot move. They're just stuck in the, one walkway. And they don't know how to do it. And they also, don't want to call the company. And I said, why don't you call? Because they said, I may be able to do it. Then they used almost whole day to figure out how to, try to actually make the robot move again. But again, that's actually another issue because that means the capacity building we need to really bring in. So you see, actually, there are a lot of variables if we really want to introduce the gerontech in the society. Can I talk one more thing? We also work with NTUC. Yeah, and then so we actually have a project together with View Technology Company, and they are using the VR in home care setting. And so for that one, I wanted to say we train the home care workers how to use VR. We developed 52 curriculum. And then so it's all related to Singapore context. So we have some context related to other countries. So we actually have the frontline worker to do the VR activities with the elderly. And then there are a few things that we find out. First, the frontline worker told us they are being empowered because the caregiver, when they see them to come in, before they see them as a helper, but because of they learn about VR, now they see them as a teachers. They will tell the elderly, your teachers come today, yeah, and then we'll play the VR with you. Then also second, the elderly feedback. Many of them they want to continue to use the VR.
I check it out.
Yeah, so that one I find that you see because they like it and they want to continue to use it. Yeah, so you see the demand, but of course it goes back to whether they have a good experience or not. You need to train the worker how to facilitate the session. It's not just about the product. At the end, you know what? It's not about the technology. We also talk about technology, right? We have to also think about whether we can promote high touch. It's about human touch.
So I was going to say, actually I have a bunch of examples of what doesn't work. So generally, actually, we don't like all the social robots, and I think Paro as well, because it is actually a novelty, right? So every now and then you take it out, it's kind of fun, and you can play with it, and then you put it back in the cupboard, and then you change the battery, and then and it's a $10,000 robotic soft toy, right? So those we find not so great, right? Because it also doesn't. It's a standalone thing. It's a standalone thing with one very narrow job, right? That doesn't really have a very clear outcome attached to it. Whereas with the VR experience, we were very clear. We were trying to bring the homebound person out of the home, and we're trying to have a way for them to have meaningful conversations. So the job was very, very clear, and it was facilitated, right? So the staff knew that this is what it was. It wasn't putting on the goggles and then just go have a look and see what you like to see. The whole point was it was facilitating a conversation. So they knew it was a tool to facilitate conversation, and it was a way to allow a homebound person to experience the outside world. So it worked into the process, and so the adoption was good. So that's kind of what I was alluding to. And I think if you think about all the barriers to adoption, which were covered amply when you think about the elderly, right? For sure, they want simplicity. And sometimes we think it's because the elderly are uneducated. So I love to bring up this example of my poor dad. Okay, he's university educated, he's very, very well educated, he's very well read. But to today, right, he doesn't have internet banking. He basically considers it not worth his effort to sign up for an internet banking account because it doesn't fulfill any job that he can do right now that with a checkbook essentially, and he doesn't miss it, right? So it's not about he uses lots of other technology, but it is about how do you get. It's not to do really even with education, etc. You've got to find something that makes it worthwhile for the person to invest the time and effort in picking it up. And don't forget now, right? When you join a hospital system, they all have their own apps. Then you want to collect points, you got to have Healthy 365, and then you want to. That's like you are competing with a plethora of apps out there. So you really have to beat all of that in order to get the person to download one more app and interact with that app, for your purposes. And then the other thing I would add is, I think in terms of technology, I would focus a bit on what will help the provider. Like, I think in the active aging space, Gen AI applications can play quite a big role in basically helping to process all the information that's out there, because increasingly the provider is expected to be master of all things and being able to triage and recommend a whole bunch of things, and the information is all out there, but to have a person be able to keep that in their head or look or know where to find the information is really quite so navigating that. But if it's in a nursing home or care setting, then things that basically alleviate the how hard the work is, whether it's mobile hoist or stuff like that, or just make it more efficient. I think that's important. But again, actually, sometimes the things that prevent a facility from adopting a technology is that if the items are too single use and take up too much space, right? So I said we are actually resource poor. So there was a time when we had these very big mobile hoists, right? But because there was nowhere in the design to store it, it always had to be stored at the end of the corridor. And then the nurses would say, by the time I go out there, get the hoist and bring it into the ward, right? Basically, I have a very, very angry resident. So I don't want to risk that, right? So I'm basically just going to not use the hoist and not have a very angry resident. So we have to work out almost that whole process of how it's going to enter into the workflow.
Thanks for sharing. You should talk to Kenneth about his infrastructure as a subscription. Then you don't need to pay 10,000 for robots. Yeah. Okay.
If I may,
It's cheaper now. It was $10,000.
Now it's 8,000. Okay, 8,000.
Yeah.
I
Adrian,
would
want to add
just
something?
add on a little bit, because I think what NTUC done, in many aspects are great, because if you look at technologies, there's two aspects of it. One is that using AR, VR is about empowerment. Using companionship robot, especially recently, just a few days ago, there was an advertisement from one of the government agency. I cannot say what I later recorded here. So in the advertisement says, come and join us for a day of fun to play with companionship robots, robotic pets, so that you can get all the care and warmth that you need as a senior. I really think that this statement is a bit, I'm not sure for the senior, but for me, are you saying that eventually when I'm old, I need to rely on robots to get all the care and concern that I need? So that was the opening statement in their email, like, come and join us for a day of fun with all the care companion robots. Then, that means where did all my family go to? So eventually when I'm old, I have to depend on a non-living thing in order to get the care that I need. So when it comes to technology, I really think like a lot of things that can be more empowering is actually more important. Yeah.
Thanks for sharing. That's why it's important to hear from the caretaker point of view as well, right? Instead of just introducing technology. Okay, my timekeeper is also chasing me to wrap it up. Maybe just one concluding questions and comments, right? Tying back to it's a health ecosystem day. And we always think that how is elder care part of the ecosystem? But we also attended many sessions, right? Whether is it the HWell, SG, or the bridging from the primary acute care all the way to home-based and community-based and elder care. So maybe from your perspective, who is the most important ecosystem player you need to work with, right, in your sector? So just now we saw, of course, ministry, regulatory, policymaker, payers, healthcare providers, VCs, tech giants, so many of the different ecosystems that you saw in panel 1 and panel 2, right? Who do you think the elder care ecosystem should partner with to really drive adoption, retention, and to move things much faster and forward?
I want to say, other than, he always asks us to choose the other top two, and now who is the major stakeholders, right?
You can
always
say
put
all.
in a very difficult position. I must say
You can
that
say all, yeah.
actually, every individual has a role to play. Yeah, and I for example, I give you an example. So everyone, you want to sell your own product, right? But you are actually in different platforms. So if I'm the operator, I will ask myself, this one use A platform, this one use B platform, this one use C platform. You think from an operator perspective, whether how I need to learn about different platform. Yeah, and then I also need to pay different platform because different platform also have different subscription fee. So you think about from our as a user perspective, how are we going to adopt? And it's all about money. Yeah, so I give you the question back to the audience here because I know you have a lot of provider here. So I hope you don't mind I pose these questions to you. The reason is I think it's very important. Hong Kong government, because I actually come from Hong Kong, I've been working here for 7 years, and every year they actually have this Gerontech summit. And I hope Singapore we can have this kind of summit also. Yeah, we can invite more providers to Singapore and then let the sector understand more about what's the advanced technology that can help the elder care sector. Because I still feel that we are still not catching up. Yeah, and a lot of things that we need to go to other countries to learn, right? I'm sure that every year Japan has exhibitions related to rehab and tech. And now actually they will go to China, Hangzhou, yeah, and they also will do a similar thing. So how about in Singapore, whether we can actually do something, as a ecosystem that we can promote use of technology in Singapore. That's one thing. And another thing that is create a common platform. Yeah, and I know that this is very difficult, but we need really major players. Yeah, and from the tech company, they can actually create this platform, to allow different products, they can actually synchronize in a major platform. Otherwise, again, it's very difficult for the operators to use the platform. I'm speaking from the operator perspective, even though I'm from the university. But from university perspective, we can do more education and training. Yeah.
Sui, you want to share? I mean, it can be beyond the tech giant or platform. Do you think you should collaborate more with, let's say, the hospitals or more with ministry to be less regulated or something like that, right? Because the ecosystem is big, right? We already see. Yeah.
I don't think this is one of those things that has a single answer because the sector is very complex. So depending on what problem you're trying to solve, you got to just find motivated partners who can work with you to solve it. And sometimes it's a commercial company, sometimes it's government, sometimes it's academia. But it's a complex industry, and as we talked about, right, there's great diversity of users, great shortage of resources. So it's almost like pick your problem area and then figure out who will work with you to solve that.
Thanks. Adrian, concluding remarks?
Oh, I have actually seen a table like this, but I think essentially the answer is that because it's an ecosystem, everyone needs to plays a part in it, and therefore, but no matter what, because in order to kickstart the ecosystem, you need financial support. So definitely the government, the investors are the key towards driving investment into the ecosystem to make it work. But that's from broader ideas. But if you ask me then, what matters to me the most is that we should start to invest into the senior themselves, the caregivers, who are the end users. Or maybe a question back to all the attendees over here. How many of you inventors actually involve the seniors as the end user to be part of your initial design phase? Or do they only come in after the product is ready and ask them to test it? So as a caregiver myself, I don't think I've ever been involved in that kind of phase. Even for myself or whatever I do, I'm a startup as well, by the way. So we involve our caregivers and seniors to form how SGSCs work as an organization. Yeah. So I hope that answers.
So very interesting discussion here. Yeah. So I think I do concur with the fact that everyone, not just our role in the ecosystem, but also our role as individuals in the society can contribute to the elder care. So just the other day, I saw this dementia go-to point, in some of the train stations, and I thought it was a really wonderful idea because every member of the public has a role to play. But one thing I also want to highlight is our importance as imaging scientists to also understand how we can actually facilitate this technology adoption better. So one of the areas that we are currently exploring is to see how we can actually use the retina to diagnose Alzheimer's disease or, for example, CVD risk. So instead of the patient needing to do a MRI scan to actually diagnose Alzheimer's disease, they can go through an eye scan instead. So this is some of the ways that I think that we as imaging scientists in a pharmaceutical company, other than reducing the cost of our clinical trials, can help to contribute as well, is also by understanding what are some of the novel imaging biomarkers that can help to reduce the adoption of this technology, reduce the challenges with adopting the technology. Yeah.
Okay, thanks. Thanks for sharing. So I think today we learned something about gerontechnology and eldercare. Thanks to the distinguished panelists.